Good afternoon. Thank you so much for coming out. I think this next 45 minutes will be very fruitful to help you understand where we are in society around this obesity and weight management issue, and how you can help people in a very simple way change their life around and get them where nature intended for them to be with a minimal amount of effort. So this really is weight loss the easy way. And so let's start from the beginning. In case you haven't noticed, and I'm sure you have, there's an obesity epidemic going on. So in the United States, you have 63% of Americans overweight, 31% of them are actually obese. So a third of the population, roughly, obese. And childhood obesity, this is the biggest tragedy, of course, has tripled just in the last 20 years. And in Canada, the statistics are not quite as bad, but they're very close. So with this childhood obesity, we are seeing kids today developing diabetes at a younger age, and they are not going to live as long as their parents. This is going to be the first time we're going to see a generation of people whose lifespans will be shorter than the previous generation. You can bet on it. They are in terrible shape. They're on cholesterol-lowering medications already. It's not because genes have gone sideways. It's because lifestyles have gone sideways. And we need to help people understand how, in a very simple way, this can be turned around. So the U.S. Surgeon General says obesity now accounts for 300,000 deaths every year in the United States, 400,000 from smoking, 300,000 from just being overweight. So being overweight is now the new smoking in terms of disease risk that it carries. It's not just some aesthetic thing that a person's trying to change. It has a huge impact, not just on lifespan, but on the quality of life and how long the person's going to remain a functional human being on this planet. And so what happens when people become overweight is, of course, there are certain health risks. There's an increased risk for heart attack and stroke. Type 2 80% of people that develop type 2 diabetes or adult onset diabetes are overweight at the time the diagnosis is made, because when you're overweight, your fat cells are larger, it creates insulin resistance. This is a lifestyle problem. We run for the cure for breast cancer, and we wear ribbons, and we go to all the galas, and yet we know that a woman's risk of having breast cancer after the age of 50, if she's overweight, is 3 times greater than if she just stays lean. We have a lot of answers in terms of how to even reduce the onset of many diseases. We don't have to go running for the cure, but running to get yourself in shape, that's a great idea. Endometrial cancer linked to being overweight. Colorectal cancer, that's emerging as being a risk as well. In men, as they have more abdominal obesity, they produce more estrogen. We think that estrogen is having an impact on prostate cancer. Gallbladder disease, osteoarthritic changes of the hip, the knee, the lower back, and the feet, all related to just simply being above the weight nature intended your body to be. Anyone here looking forward to any of those diseases? Probably not. And neither are the people who are walking around who are really overweight, people that you want to try to help. They're not enjoying this, and they're not looking forward to these diseases either. And I'm going to add a disease, because we just realized in the last year or two that Alzheimer's disease is strongly linked to just being overweight and having insulin resistance. But I want to tell you that from having counseled many people over the years, one-on-one, that the primary reason that people want to lose weight is because they want to look and feel better about themselves. That's really the primary motivation for most people to want to drop the weight, wouldn't you agree? And those health things that go along with it are almost secondary in their mind. So whatever is the motivating factor, I don't care. But what I do know is that people have to be given the right program. It has to be reasonable. It has to be practical. It has to be something they can do with their eyes closed. It can't be a whole bunch of complicated rules that just says to their brain, it's impossible, I'm a loser, I have no chance of succeeding, I've got a bad metabolism, forget it. So you have to know who to trust. So the reality is that during a lot of the 1980s and 1990s, I ran a company called Machino Nutritional Consultants. And I have a master's degree in nutrition, and one of the things that I did, I saw overweight patients, lots and lots and lots of them. In the beginning, I had no idea how I was going to help them. And I made it too complicated for them. And I tried to explain all this complicated physiology, and they just got confused, and then they just ran off to some other, fast weight loss program that wasn't going to be sustainable. I made it too complicated. But over time, I realized how to really distill it down to what is really the essence. When you first write a book, I've written 5 books now, you know, they tell you that the more time you have to write the book, the shorter the book will be. Because you'll learn how to actually, you know, get your thoughts down and make it very concise. What I'm going to show you today is how I distilled it down to have success with many, many patients over my career, and then develop wellness and weight loss programs for a number of corporations. And then with my co-author, Dr. Barry Simon, an MD and psychiatrist, we were commissioned by Prentice Hall to write the book, Break the Weight Loss Barrier, because our program really helped people break the weight loss barrier, people who were challenged for a long time. And I'm going to tell you, physiologically, it comes down to just the 3 magic principles that work for everybody, the 3 laws of metabolism, the 3 foundation principles that where every single human being has success if they just put it into place. And when I explain this to patients and exactly how it works, everybody started to have amazing results. And the thing is, it can't fail because it's working with your body's natural laws of metabolism. So what are those 3 principles I'm going to share with you? And that is, the person who's overweight has to be shrinking their fat cells every day. There are no days off. Every day you need to shrink your fat cells. Every day you put food into your body that's going to feed your lean mass, your muscle tissue primarily. And every day of your life you're going to starve your body fat. Now when you learn how to do that, shrink your fat cells, feed your lean mass, starve your body fat, everybody wins. The problem is that many people will apply one of the principles, or they'll apply 2 of the principles, and they still don't get results. The truth is that all 3 principles have to be employed for people to work and to make it work for them. And the reality, what you'll see as we go through the physiology of it, that these are the same principles that athletes actually use to get the bodies that they have that are really nicely sculpted. This is the program I still use today because it gives you an outstanding body. So the overweight person and the athletic person need to understand the principles of how they're going to feed their body and how they're going to work with their body are actually identical, and you get really good results. So I'm going to prove that to you in a few minutes. So step number 1 is, how do you shrink your fat cells every day? Well, it requires that you do 30 minutes of gentle endurance activity. You don't have to become a marathon runner and start, you know, dumbbells and doorbells and crashing into walls and hoops. Just 30 minutes of gentle endurance activity every day. And when a person does that and they get to a certain level of intensity with the activity, the amazing thing that happens is that now adrenaline is released from your adrenal glands and from your nervous system, and it goes down to the fat cells and says to the fat cell, hey baby, open the door and let the fat come out. The fat can't believe it. It's been locked in there for so long. And that fat comes out into the bloodstream and says, has no idea where it's going, but it gets into the, you know, the little highway of the blood vessels, and as it passes by the muscles that are actually doing the work, the muscles say, I could use some of that fat. Where have you been hiding? Brings the fat in, burns the fat to produce energy to keep the muscle power working. So the fat goes from the fat cell to the muscle, and the fat cell gets a little smaller, and that's exactly how it works. So ideally, you want to be in what's called the aerobic training zone, or the fat burning zone. You probably know about this. So if I'm sprinting as fast as I can, as hard as I can, as long as I can, my heart eventually is going to beat as fast as it possibly can. And we know that as you get older, your maximum attainable heart rate declines. So you can always estimate your maximum attainable heart rate, as you likely know, by taking the number 220, subtracting your age. That gives you your maximum. You don't have to exercise at the maximum. But between 55% and about 85% of your maximum, you're in the fat burning zone. And so if you take your age and you subtract it from 220, multiply by 0.55, it'll tell you the number of heartbeats per minute at which you cross into the zone where there's enough stimulation that fat comes out of the fat cell and you burn the fat during the activity. And then if you want to push harder into the higher parts of the zone, you can. But as long as you stay, above the 55% barrier, you're having results. So this is more intensity than when the patient says to me, well, after dinner we like to go a little, we do some strolling after dinner. We're not talking about strolling here. You want to do strolling, 30 minutes ain't going to be enough. You can stroll the weight off. I've seen people stroll the weight off. I've seen patients lose over 100 pounds just walking slowly. But you have to walk an hour to 90 minutes every day, minimum. People, do you have an hour to 90 minutes every day to do? People, they fight to find 30 minutes. So it's better to find the 30 minutes because you also get the cardiovascular benefits. At the very least, you need to. So let's say, what activity am I going to do? A lot of people don't want to do the more intense activities. They say, if I can just walk, you can walk as long as you walk like you're late for the most important meeting of your life. That's how I want you to walk. You walk like that, you're in the aerobic training zone, you're going to burn some fat. So forget the math. How does it feel? Feels like you're breathing harder, but you can still have a conversation with somebody. As you likely know, most of you are probably engaged in this already. And usually by the 10 to 12 minute mark, there's full body sweating. Now I know if you're a woman there won't be any sweating, but there might be perspiration or you may start to glow. That's a different thing. So it's mildly uncomfortable, but you know it's not really severe, and we're talking 30 minutes a day. And so what are the things that most people choose from? You know, jogging, power walking, stationary cycling, Stairmaster, step mill, elliptical machines. People say, well, I don't like any of those things. I said, you think I like those things? I really like to do this. I get up every morning, I can hardly wait to do this. No, you have to pick something you can tolerate. Now I'll tell you what I can't tolerate. I can't tolerate the stationary bike. That'd be like torture for me. So I have to find something that I can tolerate. Now most people, and when you follow them over a lifetime, if you're thinking about what kind of equipment to get for your house, the studies show people have much more compliance when they can exercise standing up. So if you're on like a rowing machine or a stationary bike, chances are the compliance over your lifetime are going to drop off versus a treadmill, elliptical machine, or step mill, Stairmaster, or jogging outside. Standing up, people like to stand up and exercise. Sitting down, usually the compliance is less unless you become a Tour de France cyclist. Now, the person who really got it right was Nathan Pritikin back in the 70s. He's the first researcher to ever show you could take people that had type 2 diabetes who were overweight and out of shape. They went to the Longevity Center in Santa Monica, California, and he took those people and he taught them not only how to eat the diet that I'm going to show you, but he got them to do what he called roving. So roving was, you map out, I got my patients to do this, you map out a 3-mile or about a 5-kilometer route around your home, and you put on some jogging shoes and you start and you jog. And people say, I can't jog, 3 miles or 5 kilometers. I know that. Not in the beginning. Most people can't do that. So as you start to get tired, you walk, and then as you recover, you run. Then you walk, then you run, then you walk, then you run, then you walk, then you run. And within 45 minutes, maximum, you're going to cover the whole 3. People say, how do you know what the time's going to be? Because if you were to walk the 3 miles, you'd walk it in 45 minutes. Most people will walk faster than a 15-minute mile. So if you jog it and rove it, you're going to do it faster than 45 minutes. And the more you do it, what you start to realize that you can jog for longer periods of time and you walk less, and you run more, and you walk. Before you know it, you're jogging the whole thing. I saw people, because my practice was in a fitness center originally. People would join the fitness, they were overweight and out of shape. I would do the pre-screening assessment, orthopedic neurological assessment, help the fitness staff get them on the right routine. We started a lot of people on a roving program like this just to get them to cover 3 miles a day. Some of those people went on, and I'm not kidding when I say this, to run the Boston Marathon. You don't know how far you're going to go. See, a body at rest, Newton was right, tends to stay at rest. But a body in motion tends to stay in motion. Once you get people up and moving a little bit, they get the healthy addiction. And for everybody, it's going to be at a different level. And you don't know where you're going to end up, but you have to get people started, and there's no way around this. See, I had a lot of patients that would come in and say, I hear you helping people lose weight in this program. Show me the diet, Dr. Machino, show me the diet. I said, I can't show you the diet without showing you the activity. No, I forget the activity. Just show me the diet. And I'd say, friend, you are in the wrong building. You want to go down the street to the witch doctor with the injections, the whole little meal plans, the prefab meal plans to come to your house. That's the program you're looking for. I can't condone that. Because what's important to me is not only do you lose the weight, that you become a healthier, more functional human being. That's what nature intended. That's what we're doing here. We're going to do it my way, or we ain't going to do it at all. And I have absolute standards, and I had to fire some patients on occasions. We're only doing it my way in my office. But it gets results. So activity is really important. And when the activity alone, not only do you lose weight, but it also improves vascular function, so you have a lower risk of heart attack and stroke. Exercise alone has been shown to reduce risk of colorectal cancer and breast cancer. And of course, it strengthens your bones, so there's less osteoporosis. You can have better bone density, stress reduction, mood elevation. You're familiar with this. And you feel better about yourself because you're losing weight and you get the healthy addiction, you got the endorphins flowing. You just feel better. You're a body in motion that's now staying in motion.